The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Ed Farrell. We've invited Dr. Farrell on the program today to discuss who's a candidate for dental implants. Dr. Farrell is one of 3 partners at Village Dental in the Villages in Central Florida. Dr. Farrell has a mastership in the Academy of General Dentistry. He is also an associate fellow in the American Academy of Implant Dentistry. He has been working with dental implants for over 24 years. Dr. Farrell, welcome to the program.
Randy, pleasure to be here.
Now, before we get into today's topic, your practice is in the Villages.
It is in Central Florida, and we have 3 partners, and we like to do a little bit of everything as far as the patient's concerned.
Okay.
We do restorative dentistry. That means taking a broken down tooth and fixing it, making it stronger, straighter, whiter. We do orthodontics using Invisalign, and that's the straightening of the teeth. But where we like to focus is where people are missing teeth, and we'll place one tooth, a whole set of teeth, using implants.
Dental implants. How long have you been working around dental implants, and how long have they been around?
The implants themselves have been around since the Egyptians.
Okay.
We've been trying to place something in the mouth to replace missing teeth. So now we have these implants where the bone will actually lock onto them, and we can place teeth on them, and they're permanent. So they look natural, they feel natural. You can get 40% of your chewing power back. They look great, they feel great. It enhances how you feel about yourself. So your personality, how you feel about yourself, you feel good. You can eat what you want to. You can smile.
So who is your typical patient that you see in the Villages for dental implants?
Randy, we don't have a typical patient. Anyone who's missing a tooth is a candidate.
Okay.
We have patients in their 30s to 90s, and we place implants on.
Why would a 90-year-old want a dental implant?
They tell me, Randy, they say they want the best. So, well, what does that mean? Well, they want their teeth back. They want to be able to chew. They want it to look good.
But can a 90-year-old, are they healthy enough to get a dental implant?
Absolutely. You should see the people around here, how active they are. Golf,
I mean, 78 is young
tennis,
today, there's no doubt about it.
Oh yeah, people are living longer. And they want their teeth back. They want them strong. They want them to look good. They want to be able to eat the things they couldn't eat.
Now, your 2 partners, we have them on in the second half of the show to talk more about dental implants. Do you all do, I mean, all of you do the same thing? I mean, you do the surgery and then you...
We do. We do the treatment planning.
That's not how it's normally done, you say. That normally people go to, there's 2 people involved or 2 separate locations. Expand on that.
Typically in the past, you might want to go to someone who would place bone if you need it, place the implant, and then you go to someone else who puts the tooth on top of it, where we avoid all that and make it simple. Keep it in one office and you can just go and get everything done, diagnosed and treatment planned.
So you do the surgery and you also place the tooth structure on top.
Right, exactly.
You see a lot of people rule themselves out or self-diagnose and say, I'm too old for dental implants. Does that come up?
Well, sure, there is some fear, but I think a lot of it's just lack of knowledge. If you tell them what's available, show them and let them see what's there. Let them know what their options are. Then they can say, well, why can't I have that? Well, you can. And this is how we do it. And you walk them through the process.
Now, knowing I'm going to interview you today, spoke to my mother. She's 74 years old, fairly healthy. And I told her to look into dental implants. She goes, no, I'm too old, 74 years old. And she has a denture.
74 years young.
Okay.
She's not old. Okay. We have patients in their 90s who do these implants. If you're healthy, if you can get to the office, you're probably a candidate.
So one way or another, you can do it. You say they don't know what they're missing, these denture wearers.
They really don't. And what they tell me back is that once they've had these implants done, they say, well, why don't you tell people about this? I said, what do you mean? They say, well, it doesn't hurt. I can eat better. My speech is better. I don't have all that plastic in my mouth. I look better. I feel better about myself. I smile more. It's changed how I feel about myself.
What are the different categories of dental implant patients you see?
Well, it usually starts off with one tooth. You lose a tooth and then you have some options. Well, what do? Do I replace that tooth? Well, your options are sometimes you just let it go and you don't replace it. And so what will happen is you'll lose bone in that area. The other teeth adjacent will fall into that space. Your bite will change. Then you can get gum problems and decay cavities that come along with that. Well, to change that, you can restore it. You can carve down the 2 adjacent teeth and put what's called a permanent bridge in there, which may be a good option, especially if those teeth are broken down to begin with.
Okay.
However, if you want to maintain that bone and try to put back like what's original, you'd put an implant in there. The implant stops the bone from shrinking down.
You think it prevents future tooth loss?
It does.
I mean, looked on the internet. 20 million people have dentures, I guess, in the U.S. It starts somewhere. Do you think they gotten implants that you could have prevented some of that?
Oh, absolutely. You start with one, replace it. And then each other tooth you take care of is one less tooth you're going to lose. Okay, so let's say you've already been there. You've done that. You've lost some teeth. Well, now you've got a section that you want to replace. You can still replace that section with implants. And again, put something permanent in there. Stay away from the partial. The partial is removable with the hooks on there that grab your teeth. That sometimes can do damage to the teeth, but you're still losing bone in that area with a partial.
If you have an area in your mouth where you're missing 4 or 5 teeth, and you have a partial, like you say, they're headed for more tooth loss. Is that true?
Well, possibly. That partial with the claps can grab a tooth and maybe put more pressure on the tooth, and then you're still losing bone, so then you're likely to possibly lose more teeth in that area. All right, so you've done that, and now you're into a denture. You've lost all the teeth. That bone is still shrinking, and it's going down, down, down. And when it gets to be where it's really thin, it hurts. You have the denture sitting on this thin gum and thin bone, and everything you chew hurts. So then you go to a soft diet. You can't eat the salads, corn on the cob. Well, you start eating softer foods, and they're fattier. These softer foods. So that affects your heart, your arteries, atherosclerosis. Your overall health goes down.
They avoid a lot of protein, probably as well.
Right.
I guess anything chewy, any kind of chewy food.
So you put the implants back in, you stop the bone loss, you restore function, restore health, give them something that looks good, feels good, lasts a long time.
So the basic options, overall options for denture wearers are what when it comes to implants?
Well, the denture wearer, you do have more than one option. As far as implants are concerned, you can start with two implants.
2 dental implants where?
On the lower,
okay.
And you put a ball on top of each one of those, and then your denture snaps over those 2 balls. It gives you some stability. And then you can go more than that. You can go 4, and then you have something usually connected with the bar. It snaps over that, gives you more stability.
But if somebody doesn't want a denture that goes in and out of their mouth, how many implants does it take to secure a lower denture?
We could put 4 to 6 implants in there. Now that's permanent. It doesn't come out. So when the patient's eating, it stays in. You don't have to worry about adhesive. And the nice thing about it is when you bite down and put pressure on these, it doesn't hurt because it's not resting on your gum.
Does it feel like their own teeth? I mean, did they say that? Did they say, doctor, I mean, it feels like I have my teeth back?
It's the closest thing we have. Your teeth, they're the best thing God gave us. And so for us to come back with something as close to that as we can, this is it.
Now you say you're changing people's lives.
Absolutely, every day. People come in, here, look at this one here.
All right.
This patient comes in, missing teeth, and he says, I can't eat. I need something in there that I can really
Those teeth
chew my
look
food
pretty
with.
bad. Is that, I mean, that's an unusual case?
No, we see this every day, but you won't see it.
Why?
They don't smile. They don't feel good about themselves. So they're tight-lipped. They're walking around, and it looks like they're not happy or sad or angry.
Interesting.
And so what we do is we give them something that they can feel good about, they can actually use and chew. And these people, when they're done, it changes them. It does change their life. Say, Doc, we hear it from the spouse, they never smiled this much before.
Is that right? Okay.
Now they want to join this club and that club. Now they want to do this and they want to do that. And they've got all this energy now. And where does that come from? Well, they feel good about themselves. They can do the things they wanted to do and felt as though they couldn't. And now they can.
So teeth that are in the front, that something fixed in their mouth. You could also put something fixed for the upper denture?
Absolutely. And when we do that, they get their palate back so they can taste their
What do you mean by that?
They can taste their food. The roof of their mouth is not covered. They can taste.
Okay, so a standard denture, it's always covered.
Yeah.
Okay.
It's always covered, so now they can taste their food. They get chewing power back. And so they can put their head back and laugh. And you can see the roof of their mouth, and it looks natural. It looks like they have their teeth.
How many people, what are the estimates in the villages where you are of how many people have dentures? Thousands?
Thousands of people have dentures, and they have concerns.
I mean, if it's as good as you say it is, I'm sitting here and a little skeptical. Why aren't they all doing it? Why aren't they getting dental implants?
Well, the concerns are that it hurts.
Yeah, it seems painful.
It's not. Patients tell me after they've had it done, they say, why don't you tell people about this? I say, what do you mean? They say, well, it doesn't hurt.
That's what they really say.
They do.
Okay.
They do. I give them pain pills, and oftentimes they take one. They don't take their pain pills. They say, because I don't need to. It doesn't
so like
hurt.
Motrin or something, or what do they take?
Yeah, something like that. And then as far as the cost, they say, well, I'm missing all my teeth, so I need many implants, when in fact we can replace them with 4 to 6 implants. and restore their whole mouth. The other thing is, well, how long it takes. If the right patient comes in with the right amount of bone loss, sometimes we can restore their teeth in an hour.
1 hour. Teeth in 1 hour.
Implants,
Give them an
teeth,
implant.
everything.
How soon can they eat, by the way, in an ideal situation? Somebody with a full upper and lower denture, you give them something fixed. How soon can they eat?
Depends on when the implants were placed. If we place the implants that day, we want them on a soft diet for a few weeks. Now, if we place the implants months ago, they're right into a good normal diet.
Okay, so they walk out of there with something in their mouth.
Oh yeah.
Is that a snap in, snap out? What is it?
It can be snap in, snap out. Most people would like it not to come in and out, and we can do either. We can do both. And what we do is lay out all the options for them and what's possible with implants. And so they think, well, it's not going to look natural, it's not going to feel natural. Well, it does. It gives them their chewing power back, and it looks good. It's not moving. There's no more adhesive, and it doesn't hurt. Once it's done, it doesn't hurt because there's no pressure on the gum.
You say if there was a try-in period for the denture where you give them 4 or 6 implants, that they couldn't go back to their denture. I mean, you believe that?
Well, yeah, physically you could, but they wouldn't want to go back to it.
But if there was a try-in period for a denture wear, do you think that after chewing again they couldn't go back?
Oh no, there's no way they would want to go back because they have so much, again, chewing power, it doesn't move, it's in there strong, and it's get rid of the adhesive, and it looks more natural because it's not moving, because you can eat something hard and it doesn't hurt, and you can throw your head back and laugh.
What about them falling out, the success rate?
Well, yes, they can. However, with the new technology that we have, the iCat scanner, what we're able to do is look at the bone density, the amount of bone. As far as placing the implant, so we're more careful in where they're being placed, we have a higher predictability, over 98% success rate.
So 98%, is that a national statistic?
Yes,
Possibly?
it is. Yes,
okay.
it is.
So it's a safe procedure.
Absolutely.
So where does it begin? Somebody watching this, they have a loose denture, or they're just not happy with their denture.
Starts with a phone call.
Okay.
I want to know more about implants. We have you in, we look at you, we talk to you.
Do you meet them? What are the dentists? I mean,
absolutely.
Okay.
On the first visit, we spend time, just like we're doing now. We talk about implants. We look in their mouth and see what their wants are. Look and see what's available. Let them know what their options are, and then we map it out what they can do.
We're going to take a quick break. Very interesting, by the way. Before we bring on your 2 partners on the program, anything you want to say about them?
Yeah, they're both great. Dr. Rich Hall and Dr. Mike Hards both have their mastership in the Academy of General Dentistry and also have furthered their training as far as implant dentistry as I have.
Thanks for coming on the show. Very, very
Thanks,
nice.
Randy. You're welcome.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, what you need to know about dental implants. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. With us we have Dr. Hards and Dr. Hall. Doctors, welcome to the program.
Thank you.
Thanks,
nice
Randy.
to be here.
Now, before we get into today's topic, we had your partner on the show. You both pretty much do the same thing.
Correct.
We'll start with you, Dr. Hall. What is your role there?
We all do the same thing. I mean, we've been trained the same, and that's why we all make such a good partnership. Is we have the same philosophy, we have the same type of treatment styles, and but the nice thing about it is when we get all of our heads together, and that's one of the benefits with being in a partnership.
Now, dental implants is today's topic.
Correct.
And your practice is not new to dental implants. You've been doing it quite some time.
Oh, right. You know, cosmetically, you know, we do things, but I mean, our whole focus is really comprehensive dentistry, and that includes implants, includes crown and bridge work, you know, restoring people's mouth with fixed dentistry. I think people don't like removable work, you know, as far as that goes, if they can avoid it. And so what we're looking at is ways that we can make something that's fixed in their mouths. And that means crown and bridge work, implants, you know, something that helps to preserve what they had previously.
Now, you said, we've talked a lot about this off camera and on the telephone. You say that in the villages, that's what it's called there, in Central
yes.
Florida,
Yeah.
there's a lot of denture wearers that really don't know what they're missing.
Absolutely.
With, according to you, 4 or 6 implants, you could secure a lower denture.
Oh yeah, it's
Is that
nice
right?
that way. Oh yeah, people come in, they're complaining about my denture moves, you know, when I'm kissing my wife, you know, or something like that.
All right.
So I mean, you know, this gives them some security, gives
Or
them
you
some
know,
lipper support.
I can't eat. I
Yeah.
can't function. You know, it hurts when I eat. I mean, you know, these are some of the things that we get.
Or I
What's
can't taste my food even, you know, that's the things that people
because
have
of the
concerns
roof of
about.
the mouth.
Right, exactly. With the whole denture, you know, they have the plastic all over the roof of their mouth, so they're looking for some way that they can get their taste buds back, which there is some on the roof of their mouth. So.
What are the upper age ranges of these dental implant patients?
Yeah, it's funny, Randy, that you mentioned that, because I've got a patient that's 93, 94 that I just did a dental implant on, and he just wants to be functional. He wants,
really? I mean, why go through that though at 93? It seems very painful, by the way.
No, they come in and their lifestyle has changed because they may have had a loss in their family, and now they're back out. We're social people, and so we're looking for relationships.
But this 93-year-old,
Yes.
you just did.
Absolutely.
Did he complain of pain?
Absolutely not. He had a problem. He had a tooth problem that was not fixable through the normal methods, and so we ended up having to take the tooth out. But he wanted a tooth back in there. He wanted to be like he was before, and so we put a dental implant in, and he was like he was before.
Now, your training. Let's talk about your training. Impressive background. We'll start with you. I guess after dental school.
Correct. Done a lot of training, in terms of orthodontic training, mastership in the Academy of General Dentistry.
Not a lot of guys have a mastership.
No, there's about 3,000, throughout the dental community.
Is that like 5%
which
nationwide?
is less than 1%.
1% of
Less
all
than
dentists?
1% of all dentists have a mastership in the Academy of General Dentistry.
Okay.
I have a fellowship in the ICOI, International Congress of Oral Implantologists. Same with a fellowship in the American Academy of Implant Prosthodontics. So we've all had a lot of training, in terms of continuing education, which translates into better care to the patients, we hope,
Is it true that anybody, I guess any general dentist, could take a weekend course or a couple-day training and start doing dental implants?
Absolutely, and that is one of the things that we in the community, or people in the community, are concerned about. They want to know they're with somebody that has the knowledge and the technique and the ability to place the implants correctly.
Okay, so normally it's done by two different doctors. One guy puts the surgeon.
Could be even more than that, could be more specialists involved than just the two. Normally we look at it as the general dentist being the person, the general, that sort of dictates where the treatment's going.
Okay.
Randy, what they want in our practice, what we find with our patients, they don't want to go anywhere. I had a patient in the other day, I told her I was going to send her, she started crying. So, and of course, how can you turn down somebody who's crying? Of course I'm going to treat that patient, so.
Is it true people still don't like going to the dentist? That they fear you guys?
That's true,
do you
certain
hear
number.
it? Do you ever hear patients say,
Of
boy,
course,
I hate
I think
dentists?
everyone
Absolutely.
comes in and they say, there's nothing against you, it's just that I'm fearful of a dentist. But I think once they realize what modern dentistry is today, that it doesn't have to be that way, it can be a very pleasant, non-painful situation, then I think they all feel a lot more comfortable, especially in our practice. We're fortunate we have a lot of really great staff that help us out, that put people at ease.
Everybody that comes on my show says, I have a great staff, Randy.
Our staff
I
is
told you that. You said
fantastic.
ours is different.
Ours is different. Randy, every time patients come in, one of the biggest things that the patients say about our practice is the staff is so friendly. I don't, well, you get one good staff and that staff member attracts another good staff member. So that's what we have.
Let's talk about options for denture wearers. Somebody watching this, they come in, they have an upper and lower denture. What if they've been in dentures 30 years? Could they still be candidates?
Absolutely, they're a candidate, and that's the technology you heard earlier about the iCat, the computer
That's
programs.
a CAT scan machine.
It's a CAT scan machine
That allows you to just see a clear
we can
picture
see
of it.
exactly where the bone is, how thick, how tall. Those are normal X-rays don't show that.
What are the frequently asked questions that denture wearers have when they go to your practice on the consult about the process?
Well, the questions, they vary. One of the questions, going back to what we talked about earlier, is, am I too old for this? Am I too old to get
My
a dental
mother
implant?
said she's 74 years old. Her medical doctor said you're too old.
She's just beginning her life, is what we
70's
see.
young today.
That's right.
Absolutely. It's a young, and nobody's too old, if they want to continue to have the same life they had before or improve their life. And that's what they get with
You
through
say
dental
they become
implants.
more social. Dr. Farrell said
Yes.
they become more social when they get their teeth back. Something
Randy, have you
fixed in
ever
their
seen
mouth.
somebody that constantly talks like this and you never see their mouth because they're constantly, they're ashamed of their mouth. They don't want to smile. We have actually seen when you restore these people, you fix them up, you get them a nice smile, all of a sudden they walk in and they're smiling. They're, their whole personality changes.
But of course, you're dentist, you have a bias, you think that the smile is probably the most important thing about somebody.
Well, I don't think you have to be a dentist. I think most people, when you talk to them, one of the first things they're looking at is how happy, what do you radiate to people?
Okay, good point, interesting.
And I think that's sort of comes out of your eyes and your smile, your teeth, and so people see that, and that comes across. Your whole inner self comes out through that. So I think it's really sort of an expression of who you are, you know?
Let's start with the options that these denture wearers have. I guess there's a snap in, snap out.
Absolutely. I mean, one of the things that we have found, and one of the things that the patients like the most, is it when it's fixed, you know, and we can actually do that now on 4 to 6
When you say
implants.
fixed, what does that mean?
It doesn't come in and out.
Does it come in and out?
You know,
okay.
patients have had this denture, this thing that comes out, or a partial that's come in and out. Well, we can do things now with 4 to 6 implants. It's cost effective.
So it's like a denture that goes over these 4 implants or 6 implants.
It can
and
and actually
snaps
be
and permanent.
Well, we can have which can be removable. Okay,
Okay.
those are, or it can be fixed. It can stay in the mouth. It doesn't have to come in and out. So there's a lot of stability, and they feel better about it.
And their diet changes too. When they are
How
able
so?
to.
How so?
Well, I mean, just think about it. As your diet is softer, it has to head more toward carbohydrates, you know? So, I mean, what it does is people's length of lifespan and everything else goes down with their health. If they can get more proteins into their system with a fixed appliance of some sort, then they're able to have a better lifestyle.
Now, lettuce
and longer.
is difficult for denture wearers to...
Oh, sure.
Absolutely. And Randy, research has shown that if you go into a denture, your life expectancy will go down.
Is that right?
Oh,
Absolutely.
yeah. I'd say it takes maybe 10 years off your life as you go from that. And, you know, in looking at people in extended care facilities, I think most of the people agree that, you know, as carbohydrates become more part of their life and proteins less, the quality of their lifestyle goes down too, and so does their health.
I asked Dr. Farrell this question. I'll ask you that if it's as good as you say it is, and if in the villages alone, you say, he said thousands are wearing dentures. Why aren't they doing it? What's the holdup? Is it just fear of pain? What is it?
Well, it's all those sorts of things, I think, is really what it amounts to. I think the people come out of maybe a history of that sort of lifestyle, fear of whatever it may
They
have
don't
been.
like the dents. They lost their teeth.
Exactly, and so consequently they're fearful of pain, they're fearful of the unknown, the unexpected. Maybe they aren't necessarily sure of what's going to take place, but I think that's one of the things that we like, is that there is a high percentage of success with these, almost approaching 100%. You know, as far
Meaning
as
they don't fall
But
out.
Randy, let me
Okay.
tell you first a little bit about what we do to make them comfortable. When they come in and they have this fear, number one, the friendly staff makes them feel comfortable.
All right, okay.
We spend time with the doctors. You know, that doesn't happen a lot, where you spend, you know, an hour with the doctor and feeling comfortable with what you're at. The other thing too, that we have lots of other methods. We sedate a patient. You know, it relaxes them. It makes them comfortable. So,
And they really don't complain about pain?
Oh, no.
These dental implants, I mean, in their 70s or 80s?
Vast majority of people don't have that complain about any pain at all, and they're so surprised when they come back to us, because it is like you told us it was going to be. You know, we went home and we were surprised. We were able to sleep, eat. We were just really surprised we had no pain the next day when we woke up.
Randy, your biggest critic, your
All right.
mom, possibly.
Yeah. My mother said that she's too old. She's
Absolutely.
74.
Well, I've got my mom as well. Placed a dental implant, in and out, you know, 20 minutes, and things go quick and easy, and it's just an easy procedure. And she comes back and says, "That's easy. I'm not concerned about it."
And same day. I mean, in certain cases, you can give implants the same day, put on a tooth, and they're eating again.
Right, if they have adequate bone and we're able to place the implants and meet certain criteria, we could have implants that are immediately loaded as far as that goes. So that means that you could eat on those implants that same day.
If somebody, you know, in their 70s, I mean, most people have a little bit of osteoporosis, type 2 diabetes. Are these people that still maybe candidates?
They're still candidates. They're
Right.
still candidates. And really and truly, if you can walk in the office, I mean, obviously there's things that we need to look out for, and that's why you go to someone that has the training that we do. But most patients are candidates.
Now, insurance doesn't cover this, but you have financing, things like that available.
Correct.
Absolutely. We want to make
Correct.
it cost effective for the patient. So we're going to work with that patient.
Occasionally insurance covers it, but it's not necessarily the trend.
You know, most people think they have to place a dental implant at every single tooth in their mouth, and that's not the case. Remember, we talked about 4 to 6 implants can give you something that is stable.
Okay, so fears and any misconceptions out there that you hear as dentist about dental implants that just drive you crazy? You just say, boy, that's just not true.
Well, I mean, the first thing you hear is, you know, number one, they fall out, which they don't. We've already shown 98% success rate. The other is that they hurt, and we've proven that. Every day we place implants. I mean, if they hurt like everybody said they did, we wouldn't be placing implants.
We are completely out of time. And this is good stuff, great message. To the denture wearer, Where do they begin?
Oh, they got to just come in. They got to see a dentist. They need to know what their options are. And so you just need to start with that first
If
step.
they knew, are you convinced
Oh,
that
yeah.
they all would do it?
Absolutely.
I think the
I mean, the
majority,
denture wear?
majority of people would choose to do it if they had that as a choice. You know, what should they do? They all have that as a choice. You know, the biggest thing is to make that step through the door, open the door, and walk
Fine,
inside.
it doesn't
and make,
take long.
No.
I want to thank both of you for coming on. Very good.
All right. We
Thanks,
appreciate
Randy.
it, Randy. Thanks for having us.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.